Hi, I'm Avery Ryan. I'm a speech-language pathologist and auditory verbal therapist, and I'm going to share some tips for communicating with an adult cochlear implant recipient. Most of the strategies we use with adult CI users are the same as strategies we use with pediatric CI users. However, the vast majority of pediatric CI users have prelingual hearing loss, which means they developed hearing loss before they developed speech and language. The vast majority of adult CI users have postlingual hearing loss, which means their hearing loss occurred after they had developed speech and language. So when we're talking about how to habilitate or rehabilitate each of these populations, there are some key differences in the strategies we use. There's a lot of change that happens in the first 6 months after activation. And for a lot of CI users, it really takes about a year for them to adjust and fully realize the benefits of their device. So as the communication partner in your CI user's life, please be patient with them and remember that this is a journey for both of you. So clear speech is still natural speech, but we're going to talk a little bit more slowly. We're going to pause between phrases and sentences, and we're going to use a slightly higher volume level than we would during normal conversation. Positioning refers to where you are in relation to the CI user. So you want to be close to the CI user, you want to face them, and you want to let them see your mouth. If they have better hearing on one side than the other, it's preferable that you be on that better hearing side. And really, positioning is just a big old reminder to avoid trying to speak to a CI user from another room. Say the CI user's name to get their attention before you jump into conversation. Introducing a topic is really helpful, and it's also really easy. It's as simple as saying, hey, let's talk about dinner, instead of saying, are you in the mood for Thai or Italian? When you say, let's talk about dinner, you are automatically priming your conversational partner's brain to have an expectation of what's coming next. So for a CI user who might be struggling with word discrimination, you're greatly narrowing that field of words that they're expecting to hear. Background noise can be challenging. A lot of us are so used to it that we don't even realize it's there. But this means making sure the TV's off, you're not standing near an air vent, you're not trying to speak over the sound of a car engine or water running. Our brains are used to tuning those sounds out, but for a CI user, that's a lot of competing noise that they have to try to filter out in order to understand what you are saying. It's very common for CI users to need repetition. A lot of that is because we, as their communication partners, are forgetting to use all these strategies, so we're not all that easy to understand. But if you have already repeated yourself once or twice and the message is still not getting across, change your wording. So this means if you have already said, did you do the laundry? Try changing it to, have you put the clothes in the washing machine? It's the same message, but it's different words. Avoid eating and chewing and putting your hands near your face. Those things might be really hard to understand. When you're giving really specific or important information, have the CI user repeat it back to you so you know they've heard you correctly. There are many words and letters that sound really similar. Think about the letters B, C, D, E, G, and so on. It can be really easy to get those confused. This ties into our last strategy. When you're giving really specific or important information like an address or instructions or a schedule, and you're presenting it orally, try to write it down as well. So that does it. Those are your tips for communicating with an adult CI user. I've included a link to a PDF of these strategies in the video description, and this is something that you can print out and put on your fridge as a friendly reminder. I'm also including links to the resource pages for the 3 different cochlear implant manufacturers. These are free and they're available to anyone. They include resources not only for family members, but also for CI users. So there are training exercises and auditory discrimination exercises that can be really helpful in those first few months after activation. I hope this has been helpful and gives you more confidence in how you can support and communicate with the CI user in your life. Thanks for tuning in.